Hello, welcome to Fox News Tonight. I'm Lisa Smith, and recently there's been a local case about a woman who brutally murdered her dog. Crazy. She claims that she was irritated with his barking. Tonight we're going to talk to a therapist who specializes in antisocial personality disorder. This local woman seemingly suffers from it. If you're not sure exactly what this disorder is, think of Charles Manson or Ted Bundy. Please welcome Dr. Judith Jones. Doctor, can you tell us more about this disorder?
What exactly would you like to know, Lisa?
What specific ages or culture or gender groups do often have this disorder?
Well, the disorder cannot be diagnosed before the age of 18, but the signs usually begin to show up around age 15 or even younger. The highest reported rate of diagnosis is in males aged 25 to 44, and culturally it tends to be associated with urban settings and lower socioeconomic classes, excuse me, and is much more common in males than females. However, there's a chance that this disorder is underdiagnosed in women because of the emphasis on aggressive behavior in the behavior's definition. And you can see from this example of the woman brutally murdering her dog, that's a woman, not a man, right?
Very interesting. What is the prevalence of antisocial personality disorder?
Really depends on the setting, Lisa. The prevalence in the general population is about 3% in males and 1% in females. Prevalence estimates within clinical settings have varied from 3% to 30%. This all depends on the population being sampled. Prevalence rate increases with substance abuse treatment settings and prison settings.
Men are more likely to have this disorder than females?
That's right, Lisa.
Well, we're lucky.
Yes.
So what exactly do you look for when you're diagnosing this disorder?
Bear with me, it's a long list. The exact diagnostic criteria for this disorder involve 4 different categories. First, there has to be a pervasive pattern of disregard for and violation of the rights of others occurring since age 15, as indicated by 3 or more of the following. Here's a long list of things. First, failure to conform to social norms with respect to lawful behaviors as indicated by repeatedly performing acts that are grounds for arrest. Second, deceitfulness as indicated by repeated lying, use of aliases, or conning others for personal profit or pleasure. Third, impulsivity or failure to plan ahead. Fourth, irritability and aggressiveness as indicated by repeated physical fights or assaults. Fifth, reckless disregard for safety of self or others. Sixth, consistent irresponsibility as indicated by repeated failure to sustain consistent work behavior or honor financial obligations. And 7, lack of remorse as indicated by being indifferent or rationalizing having hurt, mistreated, or stolen from another. So that's the first category. You have to have at least 3 of those. And then second, the individual has to be at least 18 years old, which we discussed earlier. Mm-hmm. Third, there has to be evidence of conduct disorder with onset before age 15. And fourth, the occurrence of antisocial behavior is not exclusively during the course of schizophrenia or a manic episode.
Wow, that is a long list. What other things would you typically see with this person, or in this person with this diagnosis that aren't necessarily in the diagnostic criteria?
Oh yes, there are plenty of associated features. Frequently, the individual lacks empathy and tends to be callous, cynical, and contemptuous of the feelings, rights, and sufferings of others. They can be arrogant and feel that ordinary work is beneath them, and they tend to lack a realistic concern about their current problems or their future. They are often excessively opinionated, cocky, and superficial, and use technical terms that might impress someone who's unfamiliar with the topic. They may have never sustained a monogamous relationship, and often they're irresponsible parents.
Oh my, that is scary. Those are scary things to hear. What causes this disorder in people? Are they born with it, or do they develop it over time?
It's a great question, Lisa. Antisocial personality disorder is more common in direct relatives of those with the disorder than in the general population. suggesting that there is a nature factor. This correlation is increased greatly when substance abuse is involved, suggesting that nurture also has a factor. Both adopted and biological children of parents with antisocial personality disorder have an increased risk of having having the disorder, but adopted children resemble their biological parents more than their adopted parents. All of this evidence suggests that there is a significant nature and nurture influence, but nature tends to play a heavier role in whether or not a child will have antisocial personality disorder.
Well, thank you for coming tonight, Dr. Jones, to enlighten us with this disorder. I know along with all my viewers, are extremely curious about this puppy killer. So thank you for enlightening us.
Anytime, Lisa.
Behaviorist psychology came into being in the early 20th century. Some of the major people associated with it are Pavlov, Watson, Thorndike, and Skinner. Behaviorism had its heyday in the 1960s and 70s, but popularity has declined since then. However, it is still used in everyday life by animal trainers, parents, and teachers. The general approach of the therapy is to modify behaviors through a system of rewards and punishments to replace an undesirable behavior with a desirable one. Usually, psychoanalytical or cognitive approaches would be used when treating antisocial personality disorder, but behavior therapy could be used to modify any undesirable behaviors, such as violent thoughts, illegal acts, or lack of remorse. Biologically, a therapist would prescribe antidepressant medication, mood-stabilizing medication, anti-anxiety medication, or antipsychotic medications to a person with antisocial personality disorder.
Hi.
Hi, Lauren. How are you doing today?
All right, I guess, had to come here. Whatever.
Yeah. Well, my name is Dr. Jones, and I'm your therapist. I think you know that. Do you know why you're here today?
Because I killed my dog. But he was just really annoying, and I just had to get rid of him.
Tell me a little bit about yourself, Lauren.
Well, I witnessed my mom kill my dad, so I had to move in with my friend, and we got into some crazy stuff. It's actually, a lot of fun, but yeah, my friends want me to come here and figure out what's wrong with me, so here I am.
Okay, well, so you killed your dog, yeah? Do you frequently have suicidal or homicidal thoughts?
Well, I almost killed my boyfriend, but he just had to go, so it happens.
Okay, well, we're going to try to modify your behavior a little bit and pull you away from some of those violent thoughts. And so, what is something that you love very much?
I guess chocolate.
Chocolate. Chocolate's good. So we're going to set up a behavior modification program using positive reinforcement and omission training. So you might not know what that is, but you're going to learn. So every time that you resist violence, I'm going to give you some chocolate. Yeah?
Alright.
Okay, cool. And the catch is, every time you are violent, I'm not going to give you chocolate. I'm going to omit that from you. I'm going to take that away from you. If you have any chocolate, I'm taking it away.
Okay.
Yeah? So hopefully through this process, we'll be able to train you to want to be peaceful and not be violent. Does that sound good?
I guess.
It's called operant conditioning.
Alright.
Yeah? Okay, well, I'll see you next week, and we can catch up on your progress and see how you're doing, okay?
Alright.
Okay, sounds good.
Thanks.